Hi everybody, this is Rhys Barber from Audiology Associates. It's our first day back in work today, so it's been a really busy day. This is actually my lunch break, so we're doing this a quick video on my lunch break. As you can see, I'm looking a little bit different. I've lost my beard, unfortunately. Obviously, we have a good fit with the face mask, so it's going to be a clean shaven me for the foreseeable future until things change. I hope you guys are all doing well. Both myself, Mrs. B, and our family are all doing well on our side, and all our staff. It's actually quite nice to be back in today, I've got to be honest. So without further ado, this is a video of one of our patients that we saw this morning. So I'll just pull this up for you, and I'll have to put my glasses on so I can see. So what we had, a lovely lady came through this morning. She's been suffering since about February with wax problems in both sides. What you can see here is we've got some very dry skin at the entrance to the canal, which we're just removing with a little bit of microsuction there. The wax behind it though, the lady has been using lots and lots of different treatments to try and clear this at home. Obviously, because we didn't have anywhere open, it was difficult to get this done. So we've used sodium bicarbonate's gone in there. There's been a self-syringing kit gone in there. There's been olive oil going in there. So basically everything but the kitchen sink's gone in there. So what we can see though is you've got some very thick, very sticky, almost a clay type wax. You know, we talk about this kind of fudgy consistency you get to wax. That's the type of wax here. Not always the easiest to remove with microsuction, just because of the nature of the wax. It tends to block the suction quite a bit, and rather than sort of pulling harder pieces away, you move in this more slightly more flexible wax back and forth, and it's adhering and sticking to the canal walls. So very blocked up on this side. Lady reporting a lot of hearing issues, a lot of pressure in the ear as well. Not really reporting any problems on the other side, but the other side is also quite full of wax. So we're going to do both ears today. So we've managed to clear the entrance now. You can see that we've got this, you can see the sticky nature to this wax. We're trying to position the suction tube on the right side and pull the wax across to the left, detach it from the canal wall. Here we are. You can see what I mean about it being more flexible, so it's not the easiest. If you're talking about having like a harder piece of wax in there, then what you tend to find is you can hold on to that harder piece and draw the whole thing down. When you've got this more flexible type, it's a lot of sort of hovering just above to lift the edges off the canal wall, which is what we're doing here. There's a slight pinch point in this canal as well, just beyond this next section, which is sort of holding it in, because obviously the wax can adhere to the sides a lot more effectively there. So it's just holding everything in place. It's not quite moving out as well as I'd like it to at the moment, but it's just a case of chipping away at it for this type of wax. There we are. We're starting to get a little bit of movement. You can see just implementing a little bit of wiggling technique there, just to loosen it off the top of the canal. There we go. You can see as we draw it down where it starts to stick again to the canal wall as it's coming away. So I'm just really trying to wiggle and bend this around the corner now just to get this out. So we'll take this leading edge away because it's going to get stuck, and try and hold on just beyond that. There we go. There we are. It's just pulled away. So you can see it's very dark in color. Now that the color of the wax will usually denote how old it is. So if you've had wax that's been in there for quite a long time, then the wax will start to oxidize and become much darker in color. So you get this very deep, dark brown, or almost black in color, which is what you can see here. But when now we've got to these deeper sections, these are the harder pieces. You can see we're actually able to draw out these slightly thinner, longer pieces of wax now. So I've popped a little bit of olive oil in here. Because this last section is a little bit harder, it's going to be wedged. Don't forget, we talk about that valley. You've got your eardrum here, and then you just get a little valley that just falls just in front of it. If it's hardened, it can harden into the shape of that. So you've got a very wide section there, and it narrows down. So you're pulling on this, and this wider section is stopping it from coming out. So that's what we're doing at the moment. Just trying to look for any looser pieces around the outside edge. I'm working this around back in. This is the standard size ulnar tube, by the way, we've got in here. You can see there, start to see the smoother edge. That's a good indication. There we go. As it pulls down from the top right corner, you can see this little glimpse of blue behind. Now that's the eardrum. That's the outer edge of the eardrum there. So we know we've got this deep section. So now I'm going to lift from the bottom, and we're going to try and tease this wax out to that little valley there. There we go. It's starting to come down. It's missed it up a little bit because of the olive oil. I'm going to take a slip of tea because this is my lunch hour. So, and there we are. So we can just grab that top section of wax now. Just slowly pull this down. There we go. It's out. It's popping. It's really moving down. You might hear the staff next door. They're all like, so this is the first time we've all been back together since lockdown. So it's quite nice to see everybody. So we're just pulling that chunk of wax away there. And you can see that the piece behind it is actually wedged on the outer part of the ear canal. It was a bit too wide to fit out, but just slowly rolling it, moving it down the canal that way. And there we are. We can see the eardrum there. It's a little tiny piece of dry wax to that left-hand canal wall. So we'll just take that away now. Slowly working down with the standard size ulnar tube. Very slowly just pulling this away from the canal wall. There we go. Lovely. So we've got the eardrum. Patient hearing much, much better on that side. Much, much better. Now, this is actually the other ear. Now, this lady wasn't reporting any hearing issues at all on this side. Now, sometimes you tend to find if you get somebody comes in with wax in both ears, one ear is completely blocked up. They can't hear very well. It's usually 9 times out of 10 is the other ear that causes you more problems because the patient hasn't really noticed they've had any issues. So they haven't really been treating that side. But what you can see here is you've got this very thick but soft outer edge layer. Okay, now this is what water, and if the lady had put any treatment in here, this is what it would have come into contact with. But we've got quite a narrow pinch point just beyond here. So we've got this wax which starts off in the canal kind of this shape and then narrows to sort of this shape and then goes back out to that shape. So we've got this kind of almost like a capital I, if you imagine, sort of wide, narrow, wide. And that's what's causing the problem here is you're pulling on the front section of this wax to remove this and kind of wiggle it up and down. But the rear section of wax then is that little bit wider, so that's holding this front section in. So it's a case of kind of trying to break away as much of this as you can, working on it, wiggling a lot to try and get this out. A little bit of dry skin in there, which is what's coming away now. Popped a little bit of olive oil in now, just to try and sort of loosen this up a little bit. It does help. It stops the stickiness. You do sometimes get, you get this kind of very slight blurring to the edge of the camera. That's just with it. As you obviously move into the canal with the endoscope, then when you've got the suction in there as well, the suction can actually cause the oil to move slightly, and it can just coat the edge. So it's a case of sort of pulling that back out and clean it off before we go back in again. You can see that pinch point now I was talking about. So you see with that wider section, now you've got this thin section now in the middle. Look how thin it is at the bottom. Ear canals sometimes pinch down into this kind of V-shaped valley anyway, but we're just trying to strip that section away. And you can see as you pass in that you keep passing to that same layer of olive oil. So it's just sort of blurring away there. So we'll take it back out and clean it off now in a second. What I'm trying to do here is I'm trying to roll the wax. So I'm trying to roll that top section of really sticky wax because you can get a good grip on it, but it tends to sort of move and flex with the movement of the suction tube. So I'm trying to hold on to the top section, draw, oh, that was really close to the camera, draw this back down then. There we go. I'm so used to doing these voiceovers without you being able to see. I keep forgetting there's a camera there, so I keep putting my hands in front of the camera. I'm sorry. But yeah, we're trying to just kind of draw this section down. I've tried pulling the top, didn't really move. Trying to pull up now from the bottom. So I'm trying to unstick it on the other side of this this little valley. We just got gaps just appeared at the top of the wax. It was a blink and you miss it moment just a few seconds ago. So you can see we've got some dry skin lifting off the canal wall there. We've got the movement. I can see when we hold on to it. See how the whole thing starts to move. With this type of wax, if you've got just a grip on one section, you haven't got the whole thing moving, that one section will move up and down. But when you get this more pronounced movement to the whole piece of wax, you know you've got a good grip. You know you've detached it from the canal wall. So now we're rolling it down. It's on its way. There we are, just holding on to this top section, just drawing it forwards. And again, there you go, a piece broke away there. Let's go back in now. There we are, it's all still staying quite mobile. That olive oil has left a layer on the skin, you see. So as the wax touches against the skin, it's going to touch against the olive oil, so it's going to stop it from adhering to that skin again. So we keep it moving. We don't move it and stick it against the opposing canal wall. It's on its way. It's starting to come down the down through that little pinch point now. Here we are, just cleaning away the sides, just to try and get a good bit of movement. I can see there's a little gap at the top, so I know we've worked it down away from the eardrum now. If we can just move it forwards, I don't think I'm going to be able to get it out of the pinch point using the suction, but what I want to do now, if we're going to use a different tool in here, say if we're going to use a Jobson horn, what I want to do is get this wax, draw it forwards into the pinch and wedge it. The reason being, if I make it too mobile and we go in with something like a Jobson horn, as I try and pass the Jobson horn, remember that's got that curved end to it, as I try and pass the Jobson horn over the top, it may well push against the wax and the wax will roll back into that space again. So you can see here it's getting quite wedged. I'd like to move it forward just a little bit more. You can see we've got that smooth section at the bottom which shows me the wax is turning, it's flicking upwards, because the smooth section has been against the canal wall. See the difference? You've got that bobbly section on the front, that smooth section on the back. So I've managed to lift it upright and pull it forwards towards the camera there. And we're going to try and wedge it, which is what we've done there. So let's see if we can pull it forwards. Well, there we go. Sometimes you're lucky and it will come away. Obviously, I've just done this, so I know it doesn't come away. But it's just kind of rolling it. So we've got a good grip now. We can see the rear of that wax. So we're going to go over the Jobson horn, into that little gap, get right behind. There you go, tilt, which is going to put the bended end behind it and draw down. There we go. We got it to the outer section. Now we're going to need to put it around the right hand side to pull it around the corner. And there we are. You can see that really thick, dark wax there. You can see just how deep that wax had gone. It was right up against the eardrum. So this is what we removed. We've got the two rulers, inches, out of the inches in months. I got two, maybe 2 1/16 of an inch, 5 centimeters there as well. So you can see you can look at how dark that is. The piece at the 2-inch mark there, or the 0 centimeter mark, is almost black in color, and you can see the color gradation as you move across the ruler there. It goes from that sort of really dark kind of ebony color into this kind of more nutty brown color, and then you've got that kind of darker section as well. So all the different ages of wax you can see all in that one ear. So let's go back to me. I'll take this back off so you can see me again. So yeah, it's a really interesting case. I think over the next couple of weeks and probably over the next couple of months, we're going to see a lot more of these cases where people have had a lot of difficulty trying to get their wax out, which means that we're going to see a lot more impacted waxes and a lot more cases that have gone on slightly longer than we would have liked. People have been really suffering, but it's, we are back open now. We are getting patients coming through. We're super duper busy in both clinics, so it's really good. I hope you enjoyed the video. If you did enjoy it, please subscribe, share if you dare, and like the video as well if that's okay with you guys. And I shall see you again on Wednesday. We're going to try and keep the videos coming. We are really busy. I'm trying to keep on top of everything at the moment, so we shall see you soon.